You see a change in the eyes here. You see a very broadening of the face. You see a very large goiter, and I've just blown it up here. And so as we kind of go through the next few slides, you're going to just start paying attention to the eyes, start paying attention to the necks, and you'll see many necks that were either full or painted slightly differently or truly had a goiter. And probably this is a, that goiter grotesque stage 4. But we're looking at that facial features, there may be more involved here. So classically, stage 3 goiters, which are slightly visible, but not obviously causing deformity, they're more likely to be endemic. They're more likely to come from painted in areas where there were hills or there were inland. And oftentimes these paintings are coming, at least in the Western world, from the Alps, Tuscany, or the Umbrian Hills. And there are two artists that we mentioned before, Botticelli and Caravaggio, who painted. Almost every other painting has someone with a goiter in it. Now, there's some debate whether they use the same model. So it could have been they were painting roughly in the same time period where they were using the same model. But if you think about prevalence of disease, even in 1958, when the WHO recommended iodine supplementation, populations that were surveyed in some of these areas, the 85% of patients had endemic goiters. Even with modern data, we know that 11 to 12% of women have thyroiditis, 3 to 4% of men have, thyroiditis. 1 out of 100,000 person has cancer. So yeah, it's pretty common pathology, I would say, to find. This is a very interesting one. What is this doctor prescribing? Just take a moment to look at this patient. We definitely see a goiter. We definitely see the eyes are rolled over. Could be one of my patients. I've been talking too much. Or the patient is possibly pregnant here also. So is this a hypothyroid patient? Is she pregnant, and is this representing a pregnancy-associated goiter? This observation in literature about a pregnancy-associated goiter is actually made by Osler for the first time, and he described a tenderness enlargement with bruits. And this is 200 years before the observation that Osler made. So perhaps she's showing the doctor the painful enlarged goiter here. She definitely looks exhausted. And in fact, if you look at antiquity, there were treatments described both in Chinese and Ayurvedic medicine for pregnant women to use seaweed products at this time period. So not really sure what this is. We're maybe reading a little too much into this, but that's kind of the journey today. And this is the classic pregnancy-associated goiter that we see in numerous art. We see a lactating mother, infant, and you see a fullness in the neck. As we go along and we start talking a little bit more about hypothyroidism and the neck masses, the classic one here of Adam and Eve is a Hans Holbein, the younger painting from 1527. You see Adam with very clear, crisp necklines. You see a clear thyroid cartilage. You see a clear sternocleidomastoid. And when you get to Eve, you see a significant fullness here. You also see a receding hairline. You see some edema around the eyes. You see a slightly different facial structure. And those are the classic signs of hypothyroidism. When we get to the Mona Lisa, and some of you may be aware of this, some of you may not, but there's significant debate over if there is a hypothyroid state that was painted. The model is Lisa Gherardini, and her description is not really present in any literature, but she has been painted in a couple of other paintings also, and she looks very similar, where we look at a slightly full neck, we look at a slightly fading hairline. We also see some edema around the inferior eyelids. And even when they're talking about the Mona Lisa smile, they say that that ability not to raise the lips more than that is pretty common in hypothyroid states. I haven't really seen those kind of patients myself, but that Mona Lisa smile may be a sign of a hypothyroid state. It was interesting, Caravaggio, who I said before, has painted numerous neck masses. In this painting, if you look at the woman on the left bottom here, I've blown her up a little bit, you see a right-sided thyroid mass with essentially 2 lymph nodes that are present in the anterior neck triangle there. Could this be one of the first representations of metastatic thyroid cancer? Possibly. As the journey continues, we get into more physiologic descriptions or physiologic renderings. This is Judith carrying the head of Holofernes. And I'm sorry, I had to crop off the head here. I guess she did the same thing. But you can see a goiter. You can also see possibly exophthalmos here. And in almost every painting of Judith, whether it's done by Caravaggio or Botticelli, you will see a goiter. And again, they could have been using the same models, but there is a chance that this may be something more. And again, this is the classic picture of Graves with the descriptions of palpitations, heat intolerance, diarrhea, nervousness, insomnia, exophthalmos, and dermopathy. Now, something a little bit more pronounced. This is from one of the altars in the Vatican. It's Transfiguration. Many of you may be familiar with Raffaello Sanzio's work. And you see the description in this painting is of a family, father and mother bringing their boy who's considered a lunatic for healing, and he is healed. When we blow up this side of this picture, you see the boy definitely has a goiter. He definitely has exophthalmos. The father also looks like he has bulging eyes. And with also one other feature here is the gynecomastia that's present here. So all telltale signs of Graves, and in fact, this may be familial Graves, which is again an autoimmune issue. So very interesting that this may be. And you know, if you look at a few other paintings, which I didn't bring today, but you talk about lunacy, you talk about altered mental status in those paintings, they're often represented with goiters. So is this a Graves ophthalmopathy or a Graves neuropsychiatric changes that are represented here? Not really sure. Goiters weren't always just used to depict pathology. They were often used to depict character, and this is a caricature of the English king and queen. They were used to demonstrate gluttony and avarice. In this Gilray caricature, you can see the king and queen have very large goiters, and these goiters are large pendulous projections from the neck that touch the money. And you know, it's not always about having a keen eye for pathology, but kind of using pathology to depict certain behaviors. And a lot of, as we go into the next phase of this talk, a lot of the endocrine disorders have been used, especially disfiguring disorders, have been used to depict certain social constructs, and it's kind of awful, actually. Here's dwarfism, and obviously we're going to move from goiters into some other things. And you know, this is a short stature endocrinopathy, likely from growth hormone production issues, but can be from other things too. Can represent congenital hypothyroidism and develop into cretinism. It was quite prevalent in paintings, and this was obviously used as, you know, depicted in a very, I would say, caricature way, where this disease was used as a, you know, to exaggerate the heights and the physical attributes of the other person in the painting. The Gonzaga family on the right, who's a big supporter in Naples for a lot of the art produced, always had a dwarf in the paintings, and it was quite infantilizing. They maintained dwarfs. Every generation of the Gonzaga family actually maintained dwarfs, and some maintained actually giants also. This is the most classic one that almost all of us are familiar with, the Velasquez Las Meninas. And you can see two different types of dwarfs here, the achondroplasia dwarf and the normal stature, short stature dwarf with normal proportions. Depictions of this can be seen in Picasso's work also. We obviously, if we have problems with underproduction, we got problems with overproduction. And there's some interesting stories around gigantism, particularly if you go to the Hunterian Museum, you will see one of the most famous acromegaliacs, who's Charles Byrne, who's represented here as an Irish. And his skeleton is at the Hunterian Museum. And his cella is described to being able to hold half a small tangerine. So quite large, I'm assuming, as a large pituitary tumor. And you know, this can also represent caricaturism, just like dwarfism did. What is kind of interesting story with John Hunter, who came by the body of Charles, that he bought or bribed the undertaker 500 pounds to get this body. A lot of anatomists of the time were after this body. And in fact, he didn't want to declare that he had the body, so he had it quickly chopped up, boiled, so he could just have the bones. and then he took the bones and displayed them about 4 years later. Obviously, gigantism has been reflected in a lot of Greek mythology, Roman mythology, Hindu mythology, where we talk about biblical the giant Goliath, which is represented here, David and Goliath. And if David was fighting an acromegaliac, it would kind of make sense. The acromegaliac would have loss of peripheral vision, diabetes, neuralgia, arthralgia, inability to hold a sword, those kind of things. So Caravaggio, again, painting a lot of endocrinopathies. Next is one of the hottest topics, and this was the cover of the Dr. Clark's book, The Remarkables. And this is a painting by Ribera, The Bearded Woman Breastfeeding. And this itself could be a discussion for an hour of what endocrinopathy led to this. Whether this is hirsute woman, prolactinoma, Cushing's, some type of androgynous adrenal tumor. But beside the intellectual curiosity of the pathophysiology, this also challenged the notions of gender and roles and sexual ambiguity all the way back in 1600. On the right is a sleeping hermaphrodite, again, a sculpture from 130 AD. The true story behind this painting is that it was actually a woman who was hirsute and was documented as starting to grow hair at age 37. This painting was sponsored by the Duke of Naples to, quote unquote, document and record a wonder of the natural world. And they actually had the child at age 52, which is very surprising. But anyway, can happen. So not really sure what endocrinopathy was here, but I think all the ones that I mentioned before are potentially responsible for this. We continue in the world of hirsutism. This is the famous family, Petrus Gonsalves family, that was part of the entourage for Henry II of France, not of England. And he came over as a slave at age 12 with the full beard. The father is represented on the right, and the son is repainted. It was painted about 20 years later, and he also had this. And perhaps this is hyperandrogenism, adrenal hyperplasia. Not really sure what is the cause here. But every single family member has, I mean, not every single family, but many family members have been depicted with this type of hirsutism. So there's probably some level of congenital genetic endocrinopathy. We obviously move on to the most famous adrenal organ of the endocrine system, which is the adrenal, our favorite. And this is from Raphael, The Fire in Borgo. This is actually a description of Virgil's Aeneid, where Aeneas is taking his dad and rescuing him before the Greeks destroy Troy. And his dad is painted a little bit differently. His dad is painted with more pigmentism, with a little bit more bronze appearance than anyone else in this painting. And this could be a depiction of Addison's disease, that weakening, that bronzing look. And obviously, not sure, but there's quite a bit of debate on this one too. And obviously Cushing's, this is an easy one. Most of you will catch this one. Lots of pictures of Cushing's throughout, lots of paintings of Cushing's. So, I want to just take a few minutes to talk about this and I'm a warm up act for Brendan today, but this is that picture of the first pictograph of a thyroidectomy in 1914. Actually, it's interesting, Coker's, we don't have it, but here's that instrument that was being used, that was described 2,000 years before. It looks like the left thyroid lobe is in the hand and somebody's coming across the isthmus with something that looks like it's a cutting and a kind of a crushing device. Anyway, thank you for your time. I just wanted to start us on this journey of, once in a while, I'll bring this to the club of some interesting paintings that we've gathered along the way. And I think one of us will look at paintings in a slightly different way. And I would recommend reading The Remarkables. It is a fantastic book and entertaining read. So thank you for your time.
Right, Joe.
Dr. Weber joined. Yay!
All right, can everyone see my screen? All right, very good. So again, thanks everyone for coming to join us on a what looks like a cloudy Monday in Atlanta, especially to, again, thank you again to Dr. Nakayama for joining us from UNC. It's really special to have this extend beyond the bounds of Atlanta. Today I'll be talking about the history of US presidents who have undergone surgery during their terms in office, specifically focusing on 5 of our former presidents and some of the misadventures that they underwent. I have no financial relations to disclose. I will say, however, I am staying out of any political phrase here. I'm a registered independent, and personally, I'm a political nihilist. So again, do not hold any political judgments against me. Here's a list of the topics that we've previously discussed. And again, thank you to Dr. Sharma for adding to this list that's really taken off in the last 2 years or so. A tradition of this meeting has always been to add the chief's portrait of one of our former faculty members. So if anyone has some blackmail that they'd like to spread on this pathway, please send them my way. But for this meeting, I'd like to add, again, a very special time around the time of our match is our new program director, Dr. Srinivasan, during her chief's banquet in 2006. As you can see, some other studious members of that class, Joy McCaffrey, now at Piedmont, and Michael Haukos, who's now our chair of cardiothoracic surgery. So the 5 presidents that we're going to be discussing today include Grover Cleveland, James Garfield, William McKinley, Dwight Eisenhower, and Ronald Reagan. Interestingly, their operations and the reasons that they underwent those operations had a lot to do with the fact that they were inherently political, and the reasons that the operations that were chosen were often mediated by political means. So we'll start with Cleveland and his oral tumor. So in 1893, Grover Cleveland took the oath of office. Actually, only a few months after taking his oath of office, he discovered a sore inside his mouth on the left side where he liked to chew his cigars. Now, as you can imagine, in 1893, this was one of the many economic panics that the United States went through. This was actually the time that they were starting to disillusion the gold standard as a means of upholding the currency. So there was a huge railroad bubble, something that 119 of the railroad companies that had existed the year prior, only 100 of them made it out of the year 1893. So it was a huge time of economic upheaval in the United States. And it is at this time that President Cleveland discovered his oral tumor. In order to not alarm the public, he actually scheduled a secret surgery for July 1st of his first term in office above his friend's yacht, the Oneida. The spokesman for the White House said that he was leaving for a few days to visit his pregnant wife at their summer home in Massachusetts. For those who are keeping score, Grover Cleveland's wife was 28 years younger than him. So, that's we'll just leave that there. The truth of the matter was actually kept to a very small circle. So he departed from Washington, D.C. The surgeons were actually snuck onto the boat overnight under cover of darkness so that no one would know that there were surgeons aboard the boat. However, they did say that a dentist was aboard the boat in order to keep some kind of claims of deniability if the secret would ever get out, that he was having some kind of mouth procedure done. But no one was aware that surgeons were actually on board. His surgical team included some of the preeminent surgeons of the day. As you can see, Janeway, of course, being of Janeway's nodules with septic endocarditis. And then, again, there was a dentist on board who administered the anesthesia. At the time, it was cocaine and ether anesthesia. And of course, it was not unheard at that time for a dentist to administer anesthesia, because at the time, it was mostly the dentists who were performing ether anesthesia at that time. Here's an actual quote from the operative report that was later published in JAMA. This was about 10 years after the original procedure happened. An incision was made through the gingival and palate mucosa to the underlying areas. Supplemental ether inhalation was used to facilitate a partial maxillectomy, including the upper alveolus from the first bicuspid to just behind the last molar. So as you can see in that photo, a fairly large incision taking up the majority of his hard palate. To the midline and a small portion of the soft palate. The remaining left maxilla, exclusive of the medial and infraorbital plate, was removed in piecemeal fashion. The cavity was packed with iodoform gauze. The operative time was 90 minutes. Allegedly, they had removed all the areas in the yacht except for the piano because it was bolted to the ground in the salon. And he was actually fitted with a rubber implant at the time of the surgery in order to prevent any kind of realization from the public that he had undergone this large surgery. The sample was sent anonymously without any names attached to William Welch, who was one of the 4 founders of Johns Hopkins Hospital, as well as to the U.S. Army Medical Museum. And both of these diagnoses reported a epithelioma, which is now, in modern day terms, a carcinoma of his maxillary palate. He actually got out for about 2 months before the press started snooping around. E.J. Edwards, who was allegedly tipped off by the dentist who had performed the ether anesthesia, published a story in the Philadelphia Press. And at the time, this was one of the great scoops in American journalism. It was kind of a scandalous story to say that the president was snuck away on a private yacht under cover of night with all these famous surgeons aboard. And of course, as you can imagine, the White House flatly denied these reports. They smeared Edwards in the press, and then a number of rival papers essentially smeared his reputation as well. And he was actually unable to get a job in the majority of newspapers around the country. The surgeon who performed his operation about 20 years later published a full account of the operation in the Saturday Evening Post because he felt that the journalist who had first reported this was unfairly maligned as a result of his reporting. I mentioned that E.J. Edwards was not able to get a job after this area because he was smeared throughout the press. But he actually was able to get one job at kind of an upstart newspaper at the time. It was only about a year into its first print cycle, but it actually took off and actually had a pretty decent future. It's actually the Wall Street Journal was the newspaper that E.J. Edwards was initially hired for, and that's where he finished his career. So fun to see that again, like young plucky upstart newspaper could turn into the Wall Street Journal. Next, we'll be discussing James Garfield's assassination, which spawned this famous quote, "I deny the killing, if your honor please, we admit the shooting." So Charles Guiteau, one of your classic crazy people, he initially campaigned for Ulysses S. Grant in the 1860s campaigns. It was when Grant lost the primary election that he actually switched over campaigning for Garfield. And there's some great stories that he actually just took his copy, his copy print from whatever pamphlets that he had printed for Grant and just substituted Garfield there, but he didn't change any of the credentials. So it would say that essentially Garfield was, the Union general who won the war. So because of all this, great publicity and great campaigning that Charles Guiteau believed that he had done, he believed that he deserved a consulship in Paris or Vienna. Allegedly, he would sit in the White House waiting room daily for about 2 months. And he would not wash his clothes. His family tried to have him institutionalized because they said, you're essentially fanatical about this election. So he borrowed $15 to purchase a .442 Webley caliber British Bulldog revolver. And there's a story that he actually paid an extra $1.50 to buy an ivory-handled revolver because he thought it would look better in a museum. So that tells you exactly his I'll say state of mind when he was going into this encounter. On July 2nd, 1881, again, another reason to avoid July in hospitals, Garfield was leaving Washington for his summer vacation. He was headed up to Amherst, which was his alma mater, to deliver the convocation there. And he was leaving from the Baltimore and Potomac Railroad Station in Washington, D.C. He was actually shot twice. The first bullet hit him in the shoulder, and then the other struck him square in the back. Robert Todd Lincoln, of course, Abraham Lincoln's son and the Secretary of War for Garfield, summoned Dr. Willard Bliss, who was a former Civil War surgeon and a close personal friend of the Lincoln family. Dr. Bliss's first description is that the president was deathly pale, almost pulseless, a very feeble pulse of about 40 beats per minute, a marked pallor of the face, skin cold and covered with a clammy perspiration, which is now we can realize is all the early stages or late stages of shock. Bliss explored the wound with his finger. It was the practice at the time because the thought was that the bullet itself would cause some kind of localized lead poisoning and the bullet itself would extrude bacteria. What he actually felt was he, put his finger in there and he felt shards of Garfield's 11th rib, but he didn't feel the bullet. He then put a probe into the wound, pushed it about 3 inches or so, and then he felt resistance and he stopped. So as I mentioned, President Garfield went into shock after this. He had vomitus, he had tachycardia and hypothermia, again, all signs of the deathly cascade of coagulopathy. The doctors with Dr. Bliss did not expect him to survive, so they called urgent calls for Hayes Agnew, who many of you will know from the portrait that is very famously presented at the Agnew Clinic at University of Penn, Sylvania, and Frank Hamilton, who was at Bellevue. The two consultants immediately came down via train to Washington, D.C., and they also, in a similar fashion, re-examined him because, again, that was the predominant theory at the time. And they also probed the wound with their unwashed fingers. So now he's had 3 unwashed hands into his wound. In the first few days, the wound began to discharge a healthy-looking pus, spit out a shard of bone and some bits of clothing. And he started developing jaundice. They actually didn't know what was provoking the jaundice at the time, but they actually delivered quinine because that was one of the few therapeutics that they had at the time that was considered to have antibacterial properties. They again probed the wound with a probe, and instead of 3 inches this time, it now probed to 4 inches deep, and it was extending more towards the iliac fossa. At the time, they didn't really have a whole lot of access to IV fluids, so they gave him Nutriv enemas, which is current practice in our trauma literature, consisting of egg yolk, bouillon, whiskey, opium, and milk, warmed to about 100 degrees Fahrenheit. And this was thought to be the way that we could replenish the losses received in shock. He had actually over the next few weeks, they had essentially probed his wound daily with their unwashed fingers and various forms of probes, including actually calling Alexander Graham Bell, who had newly invented a metal detector in order to find the bullet. By this time, the initial wound that was about 3 inches now extended to a 20-inch long incision, beginning in his ribs, extending towards his iliac fossa and his groin, and was described as a pus-ridden gash of human flesh. So again, not the prettiest picture to be left with in the setting of the US presidency. Eventually, they essentially transitioned to a comfort care measures. He was taken to a beach cottage in New Jersey to convalesce and to live out the remainder of his days. He mercifully died in September 1881, about 2.5 months after he was shot. The autopsy was actually published in JAMA, and this is a cutting from that JAMA publication. They actually find that the bullet was lodged behind the pancreas, and he had a huge retroperitoneal abscess that tracked essentially from the pancreas down into the iliac fossa. He had a ruptured splenic artery aneurysm, and they had also found that he actually had a perforated gallbladder. And it's thought that this was due to acute acalculous cholecystitis as a result of his chronic shock state. I will again mention that this is 1881. The reasons for his death are undoubtedly hemorrhagic shock without resuscitation, inadequate nutritional support, unchecked sepsis, and bronchopneumonia, all of which formed a spiraling cascade for our former president. Next, we'll move on to McKinley, and this is a presentation that Dr. Sullivan is very interested in as a former Buffaloian. Buffalon, I believe is the correct pronunciation. And I'll leave you with these series of movies and see if anyone can tell where this is going. So President McKinley was attending the Pan American Exposition in Buffalo, New York, which was held from May through November 1901. And these are actual photos from the event taken in 1901. He arrived on September 6, 1901, and he was had a reception line outside the Temple of Music, which is that building in the bottom right corner there. An anarchist named Leon Kolskux, he was Czech by nationality. However, he was born in Detroit, and he was very enthralled with some of the communist natures of the day, and thought that essentially that the belief in that the rise to socialism was being hampered by the current president. So he shot President McKinley with a .32 caliber Ivor Johnson revolver, which was concealed in a handkerchief to prevent anyone from seeing him. Interestingly, he was McKinley, rather than taking him to a hospital, he was carried to the Pan American Expositions Hospital. The hospital itself was more of a first aid tent that they called the hospital. There had actually been one operation performed at the hospital prior to McKinley, and it was an appendectomy, but otherwise it was poorly staffed and not adequately suited to the injuries that he sustained. McKinley was operated on by Dr. Matthew Mann, who is the dean of the University of Buffalo Medical School, and he was a GYN surgeon. They actually had requested Roswell Park, who was a Buffalo surgeon, as known for the Roswell Park Cancer Institute now, but he was the surgeon in Buffalo with the most experience with trauma and gunshot wounds to the abdomen. He was actually the chair of surgery at the Buffalo Medical College for over 17 years. However, he was out of town in Niagara Falls, which is about an hour's car drive, so probably about a 3-hour horse ride, doing a radical neck dissection for, it's believed to be lymphoma at the time, but he was unavailable for this initial operation. So at 5:29 in the setting sun of Buffalo, New York in September, the operation commenced. Ironically, even though this was one of the few, or one of the first expositions that had electric lighting of the exposition itself, they never thought to bring in one of the electric lights into the operating room. So they operated by the setting sun. They had medical students from Buffalo use mirrors to guide the sunlight onto the surgical bed. Dr. Mann started with a small vertical incision through the gunshot wound to the left of midline, approximately 5 centimeters below the costal margin. And what he saw is that the bullet had entered the anterior stomach. He then closed that anterior gastrotomy with silk, and then he extended the incision to explore the lesser sac. He did a very classic entros into the lesser sac, saw that there was a hole in the posterior of the stomach, and he closed that wound with silk as well. However, again, at the time, it was the practice to completely explore the wound, remove all bullets. What Dr. Mann saw was that the bullet disappeared into the retroperitoneum. He couldn't fully find it. And his thought was, if there is a retroperitoneal gunshot injury, that he, as a surgeon, was not adequately equipped to deal with the injuries, and he was concerned that the president was not going to survive anyway. So he determined that he was just going to close the, essentially to close the patient and not leave any drains. Looking back in retrospect, failure to drain the lesser sac with some kind of closed suction drain is one of the primary reasons that people have claimed that McKinley died, because he essentially had a retroperitoneal sepsis in this time. In the 8 days that the president lived after he was shot, several prominent physicians came to see him, including Dr. Roswell Park and Charles McBurney of McBurney's Point fame from Columbia, who was one of the preeminent surgeons in New York City at the time. It was noted that by September 13th, and 8 days after he was shot, gangrene had formed on the walls of the stomach, and he had severe sepsis that essentially incorporated his entire abdomen and retroperitoneum. On his autopsy, they again saw that the surgical repairs itself were actually intact, but the interabdominal wound included retroperitoneal fat and actually involved a fairly large section of the pancreas. So the superior pole of the kidney, an inferior aspect of the spleen, and as well as the descending colon. So the question was always, these wounds were not fully explored, and should this have been drained? Should these have been explored by a more facile surgeon at the time, rather than the first surgeon who was available at the time? And they never attempted to re-explore him. What McKinley's assassination led to was actually the expansion of the U.S. Secret Service. In 1865, the Secret Service was established to control counterfeiting in the wake of the conclusion of the Civil War, when Confederate currency was turning back to federal currency. So it was actually established to control counterfeiting. But after McKinley's assassination, it turned into an elite unit of bodyguards that were charged with protecting the president and his family. And that's what the theme here is, that all of those movies were ones in which Secret Service agents were involved, and thus spawned also Dr. Delman's favorite song, "And I Will Always Love You." Next, we'll move on to President Eisenhower's Crohn's disease. This is, of course, Dr. Crohn, who first described Crohn's disease as essentially a reactive ileitis back in the 1950s. Eisenhower's abdominal issues actually started several decades prior to that. In 1923, he was diagnosed with several episodes of abdominal pain, and he actually had an open appendectomy in Denver. However, his histology didn't fit with acute appendicitis, as one would expect. The histology was read out as chronic catarrhal appendicitis. Again, a very interesting pathology read for what would be a fairly straightforward operation. About 15 years later, he had another major episode of abdominal pain, was admitted to a military hospital, and they actually had prepared for operation for a small bowel obstruction. However, this obstruction resolved, and he didn't require surgery at that time. In spring 1956, during his early years of his presidency, he had recurrent abdominal pain. He was admitted to Walter Reed, and he had these radiographs, x-rays, because CT at the time was not available, consistent with this regional enteritis, which is what we would now describe as Crohn's disease. On June 8th, 1956, he had a significant episode of abdominal pain. He was coming home from the White House Press Photographers Association banquet, where Bob Hope was the entertainment for the night. His pain began just after midnight. They thought it was initially due to be indigestion. About 2 in the morning, they called the White House physician, who came in and again thought the same thing. But by 9 a.m., he had vomited twice with bilious fluid, and his doctor essentially told him that it's time to go to the hospital. Of course, as you can imagine, it was actually his wife who called the doctor, not the president himself. Once he arrived at Walter Reed, he had a series of radiographs that showed a small bowel obstruction. The Chief of Surgical Services, General Leonard Heaton, was called in to consult. So they actually sent a helicopter to pick him up from Virginia, a plane from Virginia to pick him up so that he would be able to staff the president's case. They had placed an NG tube and returned a large amount of bilious fluid. At this time, Dr. Heaton was realizing that the president was progressing towards an operation, and he wanted to load the boat with some of the kind of most well-established surgeons of the day. So he called in a number of his friends, as well as prominent surgeons, Dr. Ravden, who was another Army surgeon, Blades, who was an academic surgeon at George Washington, and Lyons, who was a private surgeon, but one of the most well-known private surgeons in the DC area. On June 9th, by 1 a.m., he had a third set of radiographs, which again showed no improvement in an SBO-type bowel pattern, and the president's bowel sounds began to disappear. So the surgeons realized that it was time to operate. He underwent an exploratory laparotomy on June the 9th. They did a right paramedian incision because they thought that a midline incision was a less advantageous repair. They did a 30-minute lysis of adhesions and found a significant portion of fibrotic inflammation with a terminal ileal stricture, about 30 to 40 centimeters of total stricture. However, they did not see any active evidence of inflammatory bowel disease. And it's been reported that Dr. Blades leaned over Dr. Heaton's shoulder and said, "Leonard, if you resect that bowel, I'll have your license taken away." What's interesting is that, again, this, as are many things influenced by politics, General Heaton had been told right before he rolled back to the operating room by President Eisenhower that he was going to be running for re-election, and he needed whatever operation would get him out of the hospital fastest with the lowest time of recovery so that he would be ready for the campaign trail ahead. So what they ended up doing was an iliotransverse colostomy, I should say, rather than a true resection. So they just did what we would call a bypass surgery now. That was not contested at the time by the 4 surgeons that were there, but has been at least discussed by surgeons around the world since, because it would be far from standard of care in the present day. What's, again, another interesting part about this, as you can see, based on the last several decades and presidents who've undergone surgery, the press was actually kept up to date this time, unlike his previous instances where they were essentially buried in detail. Otherwise, he had a fairly uncomplicated hospital stay. His NG tube was left in place until return of bowel function. He did have a small wound infection that required some sutures. It was probably presented at the M&M, and then he was discharged to Walter Reed in just under 3 weeks. Which doesn't sound, it's a little bit shorter than the average length of stay on the colorectal service. I'm sorry, Dr. Sullivan. The president actually had no further symptoms of Crohn's disease throughout his entire life, and he did not require any other abdominal surgeries for the remainder of his life, which he lived until his 80s. We'll finish up, one last president to go. It's President Reagan. He actually a twofer because he actually had 2 operations during his time as president. First one we'll be discussing is his assassination attempt, and we'll again be getting back to this photo later. Of the 40 presidents that we had from 1789, George Washington, to 2021, Joe Biden, only 4 presidents have been attacked and not hit by bullets. 5 presidents were struck and hit by bullets, and of these, 4 died. So 80% of the presidents who were hit by bullets have died, and we've talked about a few of them here. The one who survived was President Reagan. So this is probably the closest one to a lot of the folks on this call. On March 30th, 1981 at 2:27 p.m., President Reagan was exiting the I think there's a Hilton Hotel in Washington, D.C. after addressing the AFL and CIO. So he was a union man talking about labor relations in the United States. John Hinckley, who was an aspiring actor and otherwise crazy person, decided that he was going to relive the plot of the movie Taxi Driver by assassinating the president and would thus win Jodie Foster's eternal love. You can imagine how this went. Mr. Hinckley fired a Rome RG-22 blue steel revolver that he'd purchased at a pawn shop. He shot it 6 times in 1.7 seconds. As you can see, he was not a great shot. His first shot missed and hit the press secretary in the head. The second shot hit a DC police officer in the back of the neck. The third shot hit a building across the street. The fourth shot hit a Secret Service agent in the abdomen. The fifth shot hit the limousine, and then the sixth shot actually hit the limousine and then hit Reagan. This is actually one of the most interesting portions because while plenty of footage of this exists, it has been, I'll say, very widely cut so that you can't see a lot of the footage that is publicly available, even though this was actually broadcast live on television. Reagan was tackled by his bodyguard and pushed into the limousine and taken to the emergency department. They were actually headed towards the White House, and Reagan was complaining about shortness of breath. He actually he yelled at the the Secret Service agent that had tackled him, saying that he had broken his he'd broken his rib. That's why he was having so much shortness of breath. Then they pulled back his suit coat and found that he was profusely bleeding from his chest. So they decided to take him to George Washington Hospital. They arrived 4 minutes later at George Washington Hospital. He walked into the hospital under his own power with press cameras shooting, but then collapsed in the emergency department essentially as soon as he got outside the view of the cameras. His systolic blood pressure was 80 milligrams of mercury on arrival. They started with examination of his chest, showed a 1.5 centimeter gunshot wound in the left posterior axillary line at the 4th intercostal space. They did not see an exit wound. They saw breath sounds were absent over the left chest. They placed a chest tube and drained about 2.5 liters of blood. His breath sounds became then audible with reinflation of the lung, but his bleeding continued. They started with crystalloid infusion and 2 units of packed red blood cells, and his blood pressure responded. However, he did continue to exsanguinate out of his chest wound. What's interesting is actually they've published a paper that I took some figures from there. It's essentially the series of the president's x-rays from his time in the emergency department to the time he left the hospital. It's actually a pretty interesting read, just because you can follow the progress of his time while he was in the hospital. He was taken to the OR emergently for a left anterior lateral thoracotomy. They scooped out about 500 cc's of clotted blood, but they actually didn't see a whole lot of active bleeding. They determined that all the major intrathoracic structures were intact. And as you can see there on that image in the bottom right, it appears that the bullet actually stopped 2.5 centimeters from the pericardium. They performed a DPL, which was negative, and they closed up the president after about 105 minutes of operative time. Allegedly, Reagan quipped to a surgeon. He said, "Please tell me you're a Republican." Giordano, who was his surgeon, who was the head of trauma surgery at George Washington at the time, said, "Today, Mr. President, we're all Republicans." The irony is, of course, that Giordano was a major Democratic donor. After 12 days after being shot, Reagan was discharged to back to the White House. He received a total of 8 units of PRBCs throughout his hospital course. While the other, I'll say the 3 other bullets and gentlemen who were shot actually recovered well after their operation. James Brady, who was the press secretary who was shot in the head, was left permanently disabled. And he actually became a very staunch gun control lobbyist. And in 1993, he was actually on present for the signing of the Brady Bill, which was the first bill that required background checks on purchases of firearms in the United States. And actually, the White House press office is now named the Brady Room. And again, this links all back to Taxi Driver. So for those who can't recognize it, that is a young De Niro in the middle, and that is a young Martin Scorsese on the right, and Jodie Foster, of course, on the left. We'll finish up with Reagan's colon cancer. I picked jelly beans because what else can you talk about with Reagan other than jelly beans? So this was actually in his second term of office. His previous White House physician was Dr. Rouge. He was actually a neurosurgeon who was actually kind of dismayed by the position of being the White House physician. He said that he really didn't get a whole lot of opportunities to advance real political agendas. He didn't get a lot of chance to do his kind of public service. So he actually stepped down as the White House physician. And Dr. Hutton, who was a vascular surgeon by training, took over as the White House physician. In March 1985, Reagan was undergoing colon cancer screening with an FOBT test. His stool had tested positive for blood. They performed a flexible sigmoidoscopy. They found a benign polyp, but they said, essentially there's not really anything here. Hutton, again, kind of viewing things with a fresh set of eyes as his new physician, took a look at that his hemoglobin had been slightly downtrending over the last several months. And he was concerned that there was something there aside from that small little polyp that was discovered. At the time, colonoscopy was not the standard of care for a newly diagnosed or a positive FOBT test. It was just a sigmoidoscopy because that was thought to be where the highest percentage of colon cancers were, as well as the fact that fiber optic scopes were not able to traverse that far into the colon at the time. He then underwent a full colonoscopy in July, which showed an ulcerated tumor in his cecum. Biopsy was taken, which showed carcinoma. And on July 13th, the next day, a surgical team was assembled, consisting of Drs. Hutton, Dale Aller, Lee Smith, and Bimal Ghosh. Lee Smith and Bimal Ghosh actually came over from George Washington, and the 4 of them performed an open right hemicolectomy. Operation lasted about almost 3 hours. There was about 150 cc's of blood loss. Reagan's final pathology was a T2N0M-nil adenocarcinoma arising in the setting of a 5 centimeter tubulovillous adenoma of the cecum. By the post-op day 4, he was restarted on liquid diet and was discharged on post-operative day 6. What's interesting is that this was actually the first enactment of the 25th Amendment, which kind of establishes the presidential chain of power. In all, the 25th Amendment has only been enacted 3 times in United States history. The first was Reagan's colon cancer operation. The second 2 times were for George W. Bush's colonoscopies, which were only for about 2 or 3 hours at a time. There's a few others we'll finish off with that unfortunately there's not a whole lot of information on, but I think they are interesting because of when they happened in the course of the United States history. The first was George Washington, who underwent a large excision of a carbuncle arising from his left thigh. This was thought to be a saddle sore that essentially got out of control. but he underwent a large, wide local excision of what sounds like a pretty devastating carbuncle from his left thigh. As you can imagine, looking at the date there, June 1789, he was only about 3 months into his first term as the first ever United States president. So interesting that he underwent a pretty significant operation only 3 months into being the only president to ever exist. Woodrow Wilson, who in July 1918 in Paris underwent excision of nasal polyps. This is actually still very widely debated as to what kind of operation that he had. But again, looking at the timing of it in July 1918, this was about 4 months before Armistice Day. So certainly a time where Woodrow Wilson and his leadership would be very widely needed. Interestingly, later in that year, he would have a stroke due to what's thought to be neurosyphilis, and no surprise knowing that a Princeton man had neurosyphilis. And then finally, Lyndon Johnson, who in October 1967, again, kind of in the throes of what would be the lead up to Vietnam, had a basal cell carcinoma removed from his left ankle. This was actually published about 10 years later in just the kind of lay press, but again, interesting to see the timing of it. There's a few that have had surgeries before and after office. John F. Kennedy underwent 3 pretty actually significant spinal fusions before his time in office. And there's actually some conspiracy theories that think that he was wearing a spinal brace at the time of his shooting that led to him being struck in the head because his body did not slump down as it would had he been shot the first time. And that's what led to his eventual shootings, if you believe in any of that. Bill Clinton underwent a 4-vessel cabbage by Craig Smith, who is now the chairman at Columbia in New York. This is, of course, Phil Hartman. And then Jimmy Carter, who underwent a partial hepatectomy by Emory's very own Juan Sarmiento in August 2016. So just to wrap up everything, presidential operations, they're often controversial because the president is viewed as the health of the nation. Their operations are often high profile and mired in secrecy. Surgical care, as we can see from certainly Mr. Eisenhower's case, are influenced by political situations and that may extenuate beyond the medical care. And a lot of the perceptions of care that we see, for example, Garfield and the multiple probing of his incisions, is viewed through the lens of modern day surgical management and may not have been applicable during the time. So I just want to say thank you to everyone. Again, thank you for listening. Thank you for coming out on a Monday night, and we look forward to seeing you at the next meeting.
Yay.
Joe and Brendan, great presentation. I just have, can you hear me?
Yes, sir.
Yes, sir.
I'll make one quick comment. So Eisenhower came to Ashford General Hospital, which was the old Greenbrier Hotel converted to a hospital during World War II, and was under the care of Dan Elkin during that time. But I never found out why Eisenhower was admitted. It'd be interesting to know if he was having GI problems. The second comment and final comment is that when Dan Elkin became president of the American College of Surgeons, he wrote to Eisenhower and asked Eisenhower if he would speak at the college meeting. And Eisenhower wrote back and said he didn't have time, but thanks for the invitation. So a couple of little small points involving Emory as well.
Sir, it may have been the pheo that he died from. Eisenhower died of a pheochromocytoma and ischemic cardiomyopathy from a pheo.
That was a superb presentation and very much enjoyed. I'm surprised that Eisenhower was not listed as having had an operation for a stenosis of his ileum, which he had late in life at Walter Reed, and it was very heavily documented in the press. And there was a wonderful story that arose from that, that the fellow who told it said he was convinced it's why we won World War II, that Eisenhower was such an impressive critical thinker. He went in to give Eisenhower his preoperative enema. And Eisenhower said, do I have to have this? And he said, absolutely, sir. And he said, well, since when does a major give an enema in this man's army? And he said, well, that's because you're the president, sir. And he said, get the hell out of here and get a corpsman who knows how to give an enema. And the man who was put out of the room said, that's why we won World War II.
I've got a comment. Nice talk, Brendan. As I've come to admire your scholarship and all this, I think it was Lyndon Johnson's cholecystectomy that actually sparked passage of the 25th Amendment that she didn't mention. But LBJ had a cholecystectomy, and the question was who was going to be present during the time that LBJ was under anesthesia and recovering. So that's one thing that I noticed. The other thing is I'm impressed that it took the surgeons, Reagan surgeons, 3 hours to do a right colon. Like, and that's the problem of having the chair of surgery do the operation. No offense, John or Bill but
yeah, you want the guys down at the dock doing the dock work, right?
None taken.
And that's one of the problems, right? Is that it you have too many people with too many credentials, and that was part of the problem with Eisenhower's intestinal resection, that there were too many surgeons with too many credentials, and probably the worst surgeon of the bunch was the surgeon from Penn. I'm sorry, I'm blanking his name. The chair at Penn, Bill, help me.
Ravden. Dr. Ravden.
Isidore Ravden, right. So that probably was one of the reasons why they selected that particular operation.
Tom, Bob Smith, can you hear me?
Yes.
My one claim to fame as a surgical house officer was operation on Herbert Hoover for cholecystectomy. I held the retractors while Dr. Schulinger took Mr. Hoover's gallbladder out.
Wow.
When I was at Walter Reed, I heard the very same story that Bill told about Eisenhower and the Kleister pipe. It was well known at the time as a fun story. And at the time, they still had the so-called Eisenhower suite.
Yes.
And I was asked to administer an enema to the wife of a general in that suite when I was a major. It went well, but Maxwell Taylor, who was instrumental in the battle for Europe, I was present when he was operated on. I wasn't in the OR, but he had a Meckel's diverticulum that got inflamed and caused trouble when he was in his 80s at Reed.
One other important contribution by Eisenhower to Emory, when Mr. Woodruff owned the property where the CDC is now, he wanted the CDC to move from Washington. It wasn't called that then, but became the CDC later. And they were apparently considering other places. And the story is that Mr. Woodruff called President Eisenhower, whom he knew well because Eisenhower had been to his plantation several times before that. And Woodruff said that he would sell the property to the government for $1, but they had to take it within a very limited period of time or he'd do something else with it. and he was talking to Mr. Eisenhower on the golf course. And Eisenhower said, "I'll take care of it." And the next day it happened.
So just really a phenomenal job from both of the presenters. And I'm so excited to see just so many folks on the line, from prior alumni like me who are residents with me to the people who helped train us. It's very exciting, and to new alumni who we just recently graduated. So this is a very, I think, a true demonstration of the kind of fellowship that we're hoping the society keeps. I have two comments because I think I'm like now at the point that my hair is graying that I have to make comments too.
Stop it.
So one, Joe, do you think that it was just that iodine deficiency was ubiquitous, that they painted so many folks with goiters, or was it more that they found it attractive?
Yeah, I think the latter is a common theory. In fact, if you read the book, he spends about 30 pages on talking about the beauty of a full neck. And it was painted, in particularly in women, the fullness was painted as a sign of beauty. Obviously, if you do believe the data, and you're talking about Naples, Italy, and some of those places, 80–85% of the population had a goiter. They did use live models, so I don't know. You do not see that kind of a goiter picture coming out of painting that's done around the seacoasts, done around the non-inland areas. So who knows?
And then Brendan, great, obviously Eisenhower is of interest to me with the IBD work that I do. You phrased it properly. It was an ileocolostomy. At the era, internal bypass was quite common, much more common than resection. But in the current era, when people who have Crohn's disease want to talk about famous folks who've had ostomies, they often incorrectly, because they see the phrase ileocolostomy and don't recognize that that is the word for anastomosis, they list Eisenhower as a famous person who had a colostomy appliance, which isn't actually the case. So you have to correct people and say, no, he's not a famous president.
Have all of you seen a picture of the Princess of Willendorf? It's one of the earliest carvings in ivory of an obese woman. It was found in Poland or Germany. There have been many others found since, but this was probably 50,000 years old. She probably had Cushing's disease. She was enormously rotund. Anyway, who knows? It is interesting to me that Kocher, of course, gained such fame and the Nobel Prize because he had this garden of goiters in Switzerland, in Bern. And his operative skill and the experience that he published on led to his organization of the first meeting of the International Society of Surgeons. And even today, the subgroup of the ISS that is the most active is the endocrine one. He did more than 7,000 thyroidectomies.
I have to say, part of me wonders with Dr. Sharma's talk, how much of this is artistic choice versus models. Speaking as someone who's done some illustration themselves, it's kind of an interesting thing to go back and get into the heads of the artist.
And then the other part is how much of it is paint degradation over 500 years and changing the hues and things like that. So all of that's in the mix.
Because the Venus of Willendorf that Dr. Weber just mentioned is, often, I think in art history books is taught as like a, if I'm not mistaken, that's the same one you're talking about, is a fertility symbol. So, you're right. Is this a medical condition that we've attached beauty standards, fertility standards, whatever, et cetera, to? And what choices are we making now in our art that represent that?
definitely the artists of that time did work with anatomists often. They were the ones that were depicting and were painting with, I mean, not all the anatomists could paint or draw with your skill or other skills. So I'm sure there was some overlap and there were some choices. But as you get into the area of realism, you see it even more. And so I'm sure you're right.
I think, surrounding one of the points that that Dr. Nakayama made about the length of operation, done because you particularly choose the most famous people. One of Dr. Galloway's favorite stories to tell in the operating room is in regards to how history was shaped by what happened with the Shah of Iran and having Dr. Debicki do his splenectomy. Because it turned out that when Dr. Debicki did his splenectomy, he caused a pancreatic tail injury in the setting of having an impacted common duct stone, which resulted in a persistent pancreatic abscess and fistula. And it wasn't for some time that he got a common bile duct exploration to have the stone removed that was done by a less famous general surgeon. And so, Galloway always made the point, even though we have several phenomenal vascular surgeons on the line who I am not trying to in any way insult, that perhaps Debicki wasn't the right person to deal with this problem. And there's actually a nice paper that's been written about it. I think I sent to you at some point, Brendan, but if not, I'll send it to you.
SG&O, as I remember, John V, right?
Yes, sir, that's right.
All he had to do was leave a drain. We would not be there.
Well, thank you everyone for coming. I'll send out the invitation. Maybe we'll plan on something for the summer, hopefully right before the current class of chief graduates, or in July, right after the new one starts. Thanks again.
So a high standard today, Brendan.
Nice work, Brendan.
Great job, Brendan.